Welcome to this month's edition of Focus on Health. I'm your host, Dr. Barbara Brookmeyer, and today we'll be talking about cancer screening programs. And our special guest is Mary Jackson, and you may recall seeing her on prior episodes, and I'm so pleased that she's here with us again. And to remind you, she's the coordinator of cancer education and outreach at the Frederick County Health Department. Mary, welcome and thank you for joining us.
Hi, Dr. Brookmeyer. It's my pleasure.
So let's just jump right in and talk
I'm
about
ready.
why are cancer screening programs important?
Cancer screening programs are important because potentially they can save lives. And I equate this to prevention. We think about all the things that we do in terms of helping other people, taking care of our cars, taking care of our homes. I personally change the filter in my furnace every 3 months because it gets clogged. I change the oil in my car every 3,000 miles. Our health is no different. Matter of fact, our bodies are more important than the things that we own. So prevention is just taking time to take care of yourself such that you have your body works efficiently and through longevity. So it's just a matter of living well and living long.
Okay, I like that, and I like the analogy of the car and the house. And your car, it's better to avoid getting stranded from ignoring maintenance.
Absolutely.
And the same thing for our bodies. I like that.
Absolutely.
All right. Well, what are some of the cancer screening programs that are available through the Frederick County Health Department?
We have 2 cancer screening programs. They are the breast and cervical cancer screening program and the colorectal cancer screening program. And I'd like to spend a little time on each one of those. I first like to clarify that in order to qualify for these programs, you do have to be a Frederick County resident, you have to be income eligible, and you have to be uninsured. Our breast and cervical cancer program, typically known as our BCC program, when a person is enrolled, a client is enrolled in that program, they will receive a clinical breast exam, which is an exam where a health professional will go through and do a palpitation of their breast. They will also receive a Pap test, which is a test that will rule out cervical cancer, and a mammogram. And of course, the mammogram is just the X-ray that shows a picture of the inner tissue of the breast. Once they've had these exams done, this information is shared between the clinician and our community health nurses. If the findings are normal, they get a results letter indicating so. If the findings indicate that they need additional workup, extra views, or maybe a consultation with our nurse, oncology nurse, they will be seen. So what happens is that the community health nurse works with that client in order to navigate that process. But it's just an opportunity for women to be sure that they are current on their exams. Mm-hmm.
Well, that all sounds good. Now, are the exams and I guess the mammograms, are they performed at the health department?
No, we actually have contracts with individuals in the community. We have primary care physicians, we have labs, and we have radiology facilities that we connect with in order for those ladies to be seen in the community.
Okay. Well, and so how do people find out about the cancer screening programs that we have?
Well, they find out in various ways. We actually go out into the community and we promote our program. We make it, we strive to be accessible and visible in the community. We go to health fairs. We do educational sessions at the Mission of Mercy, the Action Agency, Central Hispano. So for the purpose of education, recruitment, and just making sure that there is a presence. And we also do distribution of our literature. We have brochures, we have flyers that we hand out, and of course we have our Facebook and our website at the Health Department. So we make every effort to make our program known, and I think we've done a pretty good job because we've been at the BCC program for a long time. Mm-hmm. Yeah. And the colorectal cancer screening program, it is for both men and women. And of course, there's an age requirement. You have to be at least 50 years of age. Again, a Frederick County resident, uninsured, and income eligible. Now, for those that are under 50 years of age, they are also eligible if they have like a family history or personal history of colorectal cancer. In the colorectal cancer screening program, they are seen by a gastroenterologist for a colonoscopy. Prior to the colonoscopy, of course, they have to have the bowel prep, which everybody enjoys, Once they go to the procedure itself, the whole purpose of the colonoscopy is to check the colon to see if there's any polyps, and I think we have a view of the colon right here, But the polyps is the the culprit, or can be, because if they're left there and not removed, they can increase your risk for colon cancer. So it's like a 2-for-1. You actually get the screening, but yet you're going to get those polyps removed. When the polyps are removed, they're sent to a pathologist to be biopsied. And if they are benign, and most of them are, it's all well and good. But if they're precancerous, or if they have any indication that they might be cancerous, they're then seen again through the surgeons that have to, see them later on. Sorry about that.
Mm-hmm. So, so I see that you brought a model here.
Yes.
And would you like to show our audience what you're talking about when you talk about the polyps? Because I think that's what you mentioned is really so critical, that this is one of the screening tests that can actually prevent cancer, because you can take out a polyp, and by taking out the polyp, you don't have to worry about it potentially growing into a cancer in the future.
Right. The removal of the polyp actually decreases your risk for polyps. And polyps they can be deceptive. Sometimes when they're doing the screening, they'll be matched up against the colon wall, and those are called flat polyps. And then you have the sessile polyps, which are broad and wide, and they kind of stand up. And then you have one that's called pedunculated, and it's like a mushroom. So again, the whole purpose is to remove those. And that procedure, they go up and they go through the side of the colon, through the transverse and down. But again, it just decreases your risk for colon cancer if they're removed. And oftentimes you don't even know that they're there. There's not really any signs or symptoms, and if they are, then that puts you in a different kind of precarious position, because now you have signs and symptoms. So to avoid all that, just do the recommended screenings, and your outcomes will be much better.
Well, I think that's a good place to end, but I want to ask you if there's anything else that you'd like our viewers to know.
Well, I also would like to let the viewers know that we are offering a new program at the health department, and it's our patient navigation program, and it's primarily for the insured. And you may wonder why the insured. A lot of our clients are now with insurance, and they really haven't been adapted to handle their own scheduling and so forth. So we're offering this complimentary program whereby we will assist them with their services. But they do have to still go through the same guidelines. They have to be income eligible, they have to be a Frederick County resident, and they have to have an identifiable burden, that will say that I would not be able to complete my screening, say because of a language barrier or whatever. But it is a service that we are offering, and we're looking forward to hearing from the public, and that's what we're going to be doing. So my take-home message for this is always the same: screening saves lives. And if there's anything that we can do to the public, for the public, in order to serve them, we are more than willing to do so. Please give us a call at 301-600-3362, and we look forward to hearing from them.
That's great. I hope people hear your message and call and make an appointment today, whether it's with programs through the health department or if they're privately insured.
Absolutely.
Through the providers available to them.
Absolutely, because we do have providers that do the same thing that we do for those that have their private insurance. So
great.
Be healthy.
That's great. Mary, thank you very much for joining us on today's show. And now please stay tuned for this month's Medical Myths. And now here's this month's Medical Myths. This month's Medical Myths is about preventive services for adults. A recent CDC publication reported that preventive services are available for 9 out of the 10 leading causes of death in the United States. The Patient Protection and Affordable Care Act has reduced cost as a barrier to care by expanding access to insurance and requiring health plans to cover certain recommended preventive services without copayments or deductibles. The 9 preventive services covered with no copayments or deductibles under most health plans according to the Patient Protection Affordable Care Act. And those services are blood pressure screening, cholesterol screening, colon cancer screening, diet counseling, fasting blood glucose test, which is also known as diabetes screening, hepatitis A vaccination, hepatitis B vaccination, mammogram, that's breast cancer screening, and Pap test, also known as cervical cancer screening. The first myth is that having an insurance card removes all the barriers to people getting the recommended preventive services. While research repeatedly shows that having insurance and having a higher income increases the likelihood that someone will receive those clinical preventive services, insurance coverage alone is not sufficient to ensure that everyone is offered or uses clinical services proven to prevent disease. A related myth is that those with insurance will be charged a copay or have to pay a deductible for those 9 preventive services. There may still be some insurance plans left that weren't required to cover those services at no extra charge, but for most people, they no longer have to pay a copay or deductible for those 9 preventive services. Another myth is that there is no need to get those preventive services because if you have a problem, you'll know it. Well, the truth is, that it is a deadly myth. High blood pressure is called the silent killer. That's why you need to get your blood pressure checked. You won't have symptoms until damage has already begun. It is estimated that about 1 in 4 persons who have diabetes don't know they have diabetes. Many more people have prediabetes and don't know it. Earlier awareness of having sugar problems and then taking action can lead to a longer life with fewer complications from diabetes. Another myth is about colon cancer screening. And the myth is that you only need to get the screening test if you have symptoms of colon cancer. Well, that is false. If you wait until you have symptoms, the cancer may have already spread far and the surgery required will be more extensive than if a routine colonoscopy screening were performed and the cancer were found when it was still small. A colonoscopy can also prevent colon cancer. If there is a polyp observed during the procedure, it can be removed before it ever turns into a cancer. That is why all persons over age 50 and younger persons at high risk should get a colonoscopy and follow the repeat schedule recommended by their healthcare provider. So for the reasons I just mentioned and many more, it is important for people to take advantage of the recommended preventive services, especially since there is no copay or deductible for most of those services. That's this month's Medical Myths. And now, here is this month's health tip with Amber Nally.
Hello, this is Amber Nally, health educator with the Frederick County Health Department. This month's health tip is brought to you by the Cancer Screening and Prevention Program of the Community Health Services Division. October is National Breast Cancer Awareness Month. Breast cancer affects both men and women of all racial and ethnic groups and is most often found in women ages 40 years and older. The American Cancer Society estimates that in 2015 there will be 234,190 new cases of breast cancer in the United States, and in Maryland there will be an estimated 4,730 new cases. In Frederick County, there were 773 cases of breast cancer between the years of 2007 and 2011. Knowing your breast cancer signs and how to stop it from developing can save your life, and it starts with screening. Talk to your doctor about your risk of developing breast cancer, as well as preventative measures you can take early on to protect your health. Breast cancer is almost always developed when the cells in the breast grow out of control. Screening tests can detect breast cancer early. There are 2 screening tests, a clinical breast exam and a mammogram. You need to have both tests. A clinical breast exam is performed by your doctor, and a mammogram is a low-dose X-ray picture of your breast. Women in their 20s and 30s should receive regular clinical breast exams, and after the age of 40, women need both a clinical breast exam and a mammogram every year. However, your doctor may choose to screen earlier depending on your risk factors. Work with your doctor to establish how frequently you will need to be screened. The Frederick County Health Department offers free breast screening tests for eligible women between the ages of 40 and 64 who meet income and residency guidelines. For more information on these services, please contact the Preventive Health Program at 301-600-3362 or visit us online. Thanks for tuning in to this month's health tip.
And thank you for joining us for this month's edition of Focus on Health. Please join us next month.